ongoing immune response to COVID long after the virus has left their body. And what this looks like differs from person to person. There are 150 possible symptoms, with each person having a unique combination of these. The most commonly reported symptom is fatigue, then shortness of breath, loss of smell, difficulty concentrating and aching muscles. But symptoms can also include vertigo, fever, vomiting and diarrhoea, and those name just a few. Long COVID is also relapsing remitting, meaning that symptoms can come and go with very little warning. In short, it's complicated. But what we do know about long COVID is that it is impacting a vast amount of people. According to the Office for National Statistics, in the 4 weeks before the 2nd of January, 1.3 million people across the UK had long COVID. And considering the spread of Omicron didn't peak until 30th December, the actual number suffering today is likely to be higher. Tackling long COVID is a challenge, and one that we must take on as much as tackling COVID itself. I appreciate when I applied for this debate, I caused a little confusion. Why was a Scottish MP wanting to talk about a health condition when the care of our constituents is under the remit of the Scottish Government? And in some ways they are right. And it would be remiss of me not to pay tribute to the hard work of my friend, the member of the Scottish Parliament for Edinburgh West, who has been leading the way on getting health and social care support for long COVID sufferers in Scotland. And I know his current calls for proper care pathways, specialist clinics and support from trained district nurses will hugely benefit my constituents and others. But treatment, Madam Deputy Speaker, is only half the battle. The focus of this debate today is how long COVID affects someone's ability to work and what support they need as a result. Because if we are now living with COVID, we are now also living with long COVID. We've learned a lot about this disease in the past 2 years. There was so little understanding for those people who caught COVID in those very early days, and no understanding that their symptoms could last. But they have lasted. And for that first cohort of sufferers, they have lasted for nearly 2 years. At first, it might have been understandable to think that they just need to wait it out for their health to return to normal, but we cannot say that now. It would be completely disingenuous, for the symptoms are now the reality of their daily lives. Madam Deputy Speaker, I have already mentioned that there are over 150 symptoms associated with long COVID, and the medical profession is still starting to grapple with it, and most people don't understand it much at all. And sadly, a lack of understanding is causing, as it so often does, a stigma. A stigma which is all too well known by sufferers of other diseases such as ME. Like long COVID, fatigue is a common symptom of ME, and it too comes and goes. And when preparing for this debate, I spoke to representatives from Action for ME who have extensive experience with the problems facing those who describe fatigue as their primary symptom. And what they told me is that people with ME face a significant stigma, face being told that their illness doesn't exist, or that they should just learn to push through. They have also told me that they see the same narrative and the same problems being reported for hundreds of thousands who have severe fatigue as a result of long COVID. Indeed, Action for ME has had to close its helpline and its waiting list because it has seen such a surge in people contacting them, and I can't believe that that is not unrelated to long COVID. Madam Deputy Speaker, this leaves thousands of people suffering from an illness which may well make it hard for them to work, but where their colleagues and their employers do not necessarily believe that there is anything wrong with them. How do you explain an absence or ask for support in the face of being told that you are fabricating your debilitating symptoms? A better definition, guidance for employers and a government-led campaign to boost awareness and understanding would go a very long way towards changing those attitudes to long COVID. This problem is exacerbated by those people who don't have a formal diagnosis of long COVID to fall back on. The Government's working definition of long COVID is a condition where symptoms cannot be diagnosed as being from anything else but the after effect of a COVID infection. But there is a problem. Not all sufferers of long COVID have had a positive test result for COVID. For the past 18 months, COVID tests have become a part of daily life for most of us. But those who got COVID in the first months of the pandemic were ill without ever being tested because the tests simply did not exist at that time. And this is a huge problem in a system where support, either from employers or from the DWP, requires proof. And there is a future problem here too, one that I've already referred to and perhaps the Government would like to preempt. The Prime Minister announced on Monday that free testing will end in just 5 weeks' time, and that means that more people will have COVID and might then have long COVID without that formal diagnosis. It would be a small but vital change to make sure that the diagnosis does not rely on a positive test result being on someone's NHS record. They happily give way.
Extremely grateful to her. I just wonder whether antibody testing might achieve the aim that she intends rather than antigen testing, which is what we're currently doing.
Thank you, Member, for the intervention. I would accept either testing, but what I'm also asking for is that actually proof of a positive test doesn't need to be a requirement for a diagnosis of long COVID. Thank you. Of course, it would be better for many reasons to just keep testing everyone, but failing this, I would ask the Minister to speak with his colleagues in the Department of Health about how long COVID can be diagnosed without a test result, and to commit to making sure it is not required for recognition of the disease by his own department. Madam Deputy Speaker, I'm sure that in his remarks, the Minister will tell me there is no evidence of a problem of long COVID and keeping people in work, but that is because the information is not being collected. As I've said, 1.3 million people have long COVID, and of those, almost two-thirds report an impact on their ability to carry out their daily lives. It's logical to assume that this includes employment, getting up, commuting, concentrating, completing a full day of work. And I would urge the Minister and the Department to urgently collect the data needed to find out the extent to which people with long COVID are struggling at work. I would also urge them to urgently provide guidance to employers as to how they can support employees with long COVID. At the very least, affected staff need understanding, but beyond this, employers need to know what reasonable adjustments are appropriate, how to support staff who are on long-term sick leave, and how to adjust their business practices to function in the face of increased absences. I have some experience. I worked for a time in human resources and have some experience of dealing with issues that arise as a result of those with long-term health conditions. And I have great sympathy for those in human resources who are tackling this problem now on behalf of their employers. This problem may be larger for some employers than others, particularly given the number of key workers who caught COVID by working on the front line during the first waves of the pandemic. And I have been written to by many constituents in this position. To mention just one, she was working as a healthcare support worker in the first wave of the pandemic when she caught COVID from a patient. She has been unable, as a result of long COVID, to return to work. Her employer, the local council, want to help, but they didn't know what was best to do. And there will be thousands of employees in the same position all around the country. They need guidance from the DWP as to the condition and what support they can and should be expected to be giving. And I'm told that in this regard it would be helpful if long COVID was classified as an occupational disease, and I would therefore ask the Minister to use his time today to advise whether that is under consideration and then to bring that guidance forward as a matter of urgency. Madam Deputy Speaker, I'm sure the Minister will agree with me in hoping that with the right support and guidance that most people experiencing long COVID will be able to stay in their jobs, to keep working, to keep earning, to continue in their careers. But sadly that won't be the case for everybody. There will be those who cannot work as much as they used to or who cannot work at all. And that is where our social security system steps up. The Minister knows this. It is already official government guidance that for anyone with a disability or long-term health condition, including long COVID, there is strong financial safety net. It then goes on to list available support as statutory sick pay, universal credit and personal independent payments. But as is so often the case with benefits, Madam Deputy Speaker, it is not that easy. Applying for benefits is complicated. There are a lot of forms, a lot of boxes to tick, a lot of assessments. When you have a debilitating condition like long COVID or like one of the other relapsing remitting diseases I've already mentioned, you might not be able to sit and complete a 30-page form in one go, or even in the course of a week or two. Research by the MS Society has shown that a third of people with MS thought 4 weeks was not enough time to complete forms, but that the majority of applicants did not know that they could request a 2-week extension. A simple solution to this is simply extend the time allowed to complete forms. There is no incentive for claimants to take excessive time because they want to get the support that they need. Meanwhile, it uses up DWP resources, requiring people to request extensions. Setting up the time to return the forms at 8 weeks would be a simple and cheap solution. If the Minister disagrees and prefers a system that doesn't work for disabled people and also costs his department money, then will at least commit to including clear information on the PIP application form about how people go about applying for an extension. And whilst we're thinking about the forms, does the Minister agree with me that the forms ought to be designed to be usable by the people completing them? Because people with relapsing remitting conditions, of which long COVID is just one, don't find those forms usable. There is no space in the forms to properly explain the impact of having fluctuating symptoms. It doesn't work for people with long COVID, and these forms must be fit for purpose, and I strongly encourage the Minister to consult with disabled people on this. Madam Deputy Speaker, long COVID is a novel condition, And DWP, like all of us, are having to learn and adapt. But as DWP staff see more and more individuals with long COVID, it is vital that they receive the appropriate guidance and training. Universal credit requires claimants who can to look for work. In fact, more recently, it required claimants to look quite quickly to look for just any work at all. But are work coaches trained in what sort of requirements are appropriate for someone with a relapsing remitting disease, where someone fatigues quickly or has a brain fog, or any of the other 100-odd symptoms of long COVID? I look forward to hearing from the Minister about what guidance is in place and what support is offered, but I do fear there is little. The same is true for PIP assessments. A PIP assessment is supposed to determine what additional support you need as a result of your disability or illness. But again, this is an impossible test for anyone with a fluctuating condition. You could be functioning one day, even okay, but then the next unable to get out of bed. But one assessment, just one assessment on one day, determines whether you get that support or not. And that system just doesn't work. And of course, this system is not just failing long COVID sufferers, but those with ME, MS and chronic pain, to name a few. There is a simple solution which I ask the Minister to adopt, which is allowing for more weight to be given to medical evidence, to the information provided by doctors, by the experts in someone's condition, by the people who see claimants on their good days and their bad days. It is an obvious solution. Madam Deputy Speaker, there are other ways the assessment process could be reformed to better support all disabled people, including those with long COVID. Specialist assessors, an end to the 5-week waiting period and increasing payments in line with inflation are vital for the health and well-being of all disabled people. I await the publication of the Government's White Paper this spring and wonder if the Minister is in a position to provide an update on that this evening. But those with long COVID cannot wait until then for their condition to be properly recognised by DWP and their employers. The pandemic has been the biggest mass disabling event since the First World War, and long COVID isn't going away. We have seen COVID ripping through classrooms over the past few months. Long COVID doesn't just affect people of working age. Children suffering are going to miss education and training. Madam Deputy Speaker, it doesn't matter if, like me, you view social security as a public service and a safety net, or indeed if you see DWP as a means to get people into work. From either perspective, the Government must do more to support those with long COVID, to stay in work, to get into work and to get the support they need if they cannot work. Information about the impact of long COVID on employment, formal recognition of long COVID as a debilitating condition, as an occupational health disease which affects somebody's ability to work, proper guidance and training for employers and DWP staff, and an assessment process that works for people with fluctuating symptoms. Madam Deputy Speaker, the Prime Minister told us on Monday that it was time to get our confidence back. Those words are cold comfort to those suffering the debilitating impacts of long COVID. They need practical support and they need it now. I urge the Minister to heed them. Thank you.
Mr. Guy Opperman.
Madam Deputy Speaker, the Russian invasion into Ukraine colours everything that we talk about today, and I just want to put on record my support for what has been said today by all political parties. I'm sure I speak for all colleagues in the House on the front and back benches, and that we stand with the people of a sovereign, independent Ukraine. And we are a legitimate democracy, Madam Deputy Speaker, which means that we can debate things. We can have a discussion in a way that other countries like Russia cannot do so. And so I congratulate the Honourable Lady for securing what is a very, very important debate on a very, very important issue. And I want to particularly make the point that the Disability Minister, who would normally answer this matter, as she knows, cannot be with us tonight because of personal reasons, but apologises for that, and I am here to answer to the best of my ability all matters on behalf of the Government. And I want to make at the outset that the Government recognises the impact of long COVID on individuals and their families. We are committed to working across Government to ensure appropriate provision and support is available to those suffering from the condition of COVID. Clearly, she is right. We have been through the worst pandemic since, frankly, the Spanish flu of 1919, and it is clearly all governments around the world are playing catch-up in an attempt to understand, appreciate and deal with the consequences of this terrible disease. It is also a chance for us in this House to put on record our thanks to the pharmaceutical companies and everyone behind the vaccine task force, the NHS, the public, private and the volunteers behind the vaccine rollout, and we cannot have a discussion on COVID without raising the specific issue that it is in everybody's interests to get the jab. I have done everything possible, including videos with my dog Zola, to encourage the vaccine take-up, and it is very much in our interest that we have a continuation of the vaccine take-up, and there are still, sadly, a significant proportion of this population who have not had the jab, and we would still urge them to go forward and do that. It is, of course.
I'm extremely grateful to him for taking this intervention. One of the things I noticed when I look at the vaccination map that the government's brilliantly provided is that it's the areas of Wickham with the highest ethnic minority populations which is least vaccinated. Could he tell us, if he can, take this opportunity on this unscheduled intervention to tell us a bit more about what the government's doing to help those people?
Well, there is a great deal that is being done. I will certainly write to him and set it out in copious detail. But the most important thing is that thought leaders, whether they're voted for or not voted for, make the case in their communities that people need to get the jab. And that ranges not just from members of parliament, but also to religious leaders, to community leaders, because the way out of this and the way back to normal life and living with COVID is quite clearly an embracing of the particular vaccine. There is much more I could touch upon, but that would be the main thing I would make. I would also refer, obviously, to the specific guidance was set out in the very detailed response of living with COVID-19 that put forward by the Prime Minister. The Honourable Lady indicated that there is no reference in his statement to long COVID. That isn't the case in the document itself. I would refer particularly to paragraphs 87 and 118. But quite clearly, this is a work in progress. There is no doubt whatsoever. And I'll try and come to in a bit more detail the specifics of that. We remain, however, committed to ensuring that everybody is able to access the help and support they need. We're doing what we can to ensure that care pathways are available and clearly signposted, and that people needing extra help will receive it. I want to touch, because she rightfully raised the issue, the fact that she is a Scottish MP, but this is a devolved system, as to very briefly touch upon the health approach, and then I'll turn to the benefits approach. So the Department for Health and Social Care has invested over £50 million in dedicated research to improve the diagnosis and treatment of long COVID. In addition, NHS England and NHS Improvement have invested £224 million to provide care for people with long COVID, including £90 million in 22-23. There are 90 long COVID assessment services across England, including 14 specialist paediatric hubs that have been established to support adults, children and young people with long COVID and to direct them into appropriate care pathways. The government recognised that while England has adopted a clinic-based service model, no one single approach is likely to fit all areas and all circumstances, and it is right and proper that each part of the UK is able to adopt a service model for long COVID that most effectively responds to the patient's needs. This recognises that everyone, and this goes to her point, experiences long COVID differently, and that health services are also organised differently depending where they are. Briefly, in Scotland, I understand that the NHS boards are developing pathways between primary and secondary care according to local services and the needs of their respective populations, with a focus on providing care and support as close to home as possible. In Northern Ireland, assessment services have been established reaching multidisciplinary assessment and support in primary and secondary care settings. Similarly, in Wales, they have established the recovery programme, whereby the majority of people assessing services will do so directly via their GP practice, and following assessment, people may be supported by a range of healthcare professionals depending on their individual needs. Madam Deputy Speaker, can I now turn to the issue of benefit entitlement? It is vital that the existing benefit system provides inclusive, accessible and sustainable support to people who have all health conditions that impact upon their ability to work and participate fully in society, and that includes, obviously, people with long COVID. But the benefit system is set up to consider the impact that a health condition has on an individual's ability to work and carry out day-to-day activities. In the case of long COVID, there will be an assessment of a person's needs in the same way as for other conditions, by understanding the impact it has on their day-to-day activities. Claimants can apply for benefit on the basis of their symptoms and the impact that they are having on them. The Honourable Lady rightfully outlined that there are a multitude of different symptoms, and it kind of goes to the point I made that The NHS in the UK, and particularly in England, certainly, and I can't speak for Scottish NHS in detail, are making great efforts to actually have a better understanding of diagnosis and treatment. But clearly, the main symptoms would be pain, fatigue, breathlessness, and some things that are akin in many ways to ME and other illnesses. And clearly, how they fluctuate are particularly relevant to long COVID and the ability to function on an ongoing basis. Now, assessments for health and disability benefits do take these matters into consideration, and our healthcare professionals are trained to explore and evaluate